Welcome to the deep dive. If you've spent any time around horses, you probably know there's one challenge that can, well, sneak up on us.
Mhm.
It silently impacts our equine partners and often turns their athletic endeavors into a real struggle. We're talking about equine back pain. It's common, often kind of puzzling for owners and riders, affecting everything from performance to behavior and just their overall well-being.
It truly is a silent struggle for so many horses. And yeah, for this deep dive, we've gathered a stack of your sources, specifically expert excerpts focused on equine back pain, diagnosis, treatment, and prevention. Our goal here is really to cut through the complexity, pull out the most crucial insights, maybe some surprising facts, and definitely the practical knowledge. We want to help you quickly get a really solid handle on this important topic.
Okay, so when we say equine back pain, what exactly are we talking about? Is it just one specific thing or more of a general category?
Well, it's definitely a broad term. Essentially, we're referring to pain anywhere along the thoracolumbar spine, that's, the main section of the back, from behind the withers down towards the pelvis. Or it could be pain in the associated ligaments and muscles in that area. And as you probably know or have experienced, this kind of pain is directly linked to poor performance, changes in gait, and those unwanted behaviors we sometimes see in ridden horses. It's a significant issue.
That makes a lot of sense. So for folks listening, who tends to be most affected? Are we looking at certain breeds or ages or maybe specific disciplines?
Well, the sources consistently point towards middle-aged performance horses being particularly susceptible. We often see it in disciplines that ask a lot from the horse's back,
Yeah.
like jumping, racing, and dressage. The repetitive nature of the work, the specific physical demands,
hmm
it can really take a toll over time.
Right, okay. So we know who it often affects. Now let's talk about what it actually looks like. As owners, we're usually the first ones to pick up on those like subtle shifts, right? What are the typical things owners notice first?
Yeah, you're spot on. It often starts subtly. Owners frequently report things like a decrease or maybe just a change in performance, perhaps a sudden reluctance to work, or refusing jumps they used to clear without a problem. You might also notice difficulty with collection. Maybe they struggle holding it or they get fussy during transitions.
I can definitely picture that. And what about just their general attitude or behavior? Does that change too?
Absolutely. Behavioral changes are a huge red flag. You might see resentment to grooming, especially over the back, or during saddling, the term cold-backed, where they dip or tense up when the saddle goes on. That often points towards back discomfort. And if it gets worse, well, then you can see more dramatic things like bucking, rearing, kicking out, or even just pinning their ears when ridden. Sometimes it's less obvious, maybe just an ill-defined stiffness or a feeling like they lack impulsion, not really pushing from behind.
It's amazing how many of those are things we feel under saddle or see daily. And I guess if there's a history of some kind of trauma, like a fall or maybe an incident in the starting gate, that's another clue.
It certainly can be, yeah. A past trauma is definitely a relevant piece of the history. Now, moving from what you might notice to what a vet is looking for during an examination, there are several key physical things they check.
Right. So when the vet comes out, what are they physically looking for or feeling for?
Well, during a physical exam, the vet starts with a visual inspection. They're looking for visible signs like muscle atrophy, that's a wasting away of the back muscles, and it's often not symmetrical, so one side might look different. They'll also look for changes in the spine's normal curve, things like kyphosis, which is a roached or upward curve, or lordosis, a swayback where it dips down, sometimes even scoliosis, a sideways curve. And then crucially, there's palpation, gently feeling along the back. They're checking if touching specific areas causes resentment or muscle spasms or fasciculations, which are those little muscle twitches. Those often indicate irritation or deeper pain.
Okay, so we've got the signs, but what's actually causing the pain underneath it all? What are the common underlying issues and risk factors?
The causes are quite varied, and often they're sort of interconnected. Conformation can play a role. Horses that are maybe very short-backed, or conversely, very long-backed, can be predisposed to certain back problems. Poor or improper training methods are a really significant factor, especially if a horse isn't conditioned gradually for the work demanded. And here's a really critical connection the sources highlight: chronic coexisting hind limb lameness. If a horse is consistently sore in a hind leg, it will often change how it moves to compensate, and that puts extra strain on its back, leading to secondary back pain.
Wow, that connection is huge, isn't it? It really underscores how everything in the horse is connected. Pain in one spot can absolutely show up somewhere else. And of course, the thing we hear about constantly, poorly fitting saddles.
You hit the nail on the head there. That's probably one of the most common and importantly preventable causes. A saddle that doesn't fit right creates pressure points, restricts movement. It's a direct route to back pain. And yes, as we mentioned, certain sports, especially jumping because of the impact forces and the degree of flexion and extension required to definitely predispose horses to back issues. Beyond those factors, there are specific diseases that cause primary back pain. Probably the most talked about is impingement or overriding of the dorsal spinous processes, what most people call kissing spines.
Kissing spines, yeah, that's a term many horse owners have heard. Are there other specific conditions vets look for?
Sure. Other possibilities include fractures, like fractured withers or other vertebral bone fractures. There's also spondylosis or discospondylosis. Those are degenerative changes affecting the vertebrae and the discs between them. Osteoarthritis of the facet joints in the spine is another one. And also supraspinous desmoitis, which is inflammation of that big ligament running along the top of the spinous processes.
Okay, wow. So a lot of potential underlying causes. Now, this seems like the really tricky part. How do vets actually solve this puzzle and diagnose the back pain? Because it sounds like it's rarely straightforward.
You're absolutely right. Diagnosing back pain is often like putting together a complex puzzle. It requires a very systematic approach. And the biggest challenge, like we touched on, is that primary back pain can look a lot like hind limb lameness, and the other way around too. So figuring out the original source is incredibly tricky.
So how do they start unraveling that? What does that systematic, multifaceted approach actually involve?
It really has to start with a detailed history.
Hmm.
And this is where your observations as the owner are just invaluable. The vet will ask about those specific performance issues. Maybe the horse goes disunited in the canter, legs out of sync, or resists bending or lateral work. They'll want to know about any behavioral changes, how the pain seems to relate to the rider or the saddle or the type of work. Any previous lameness history is vital. And then general management stuff too, like turnout time, exercise routine, all those details matter.
Got it. So the conversation is key. Then comes the hands-on part, the actual physical exam. What happens there?
Right. So in the static exam, with the horse just standing still, the vet will systematically palpate the whole spine, thoracic, lumbar, sacral regions, and all the big muscles around it. The longissimus bursae along the top, the multifidus deeper down, the gluteals, even the hamstrings. They're feeling for any pain response, muscle spasm, asymmetry, muscle wasting, or even unusual heat. They'll also look closely for symmetry, muscle development, those abnormal spinal curves we mentioned, or maybe prominent bony points. Plus, they'll do specific manipulations like lifting the tail, gently rocking the spine, pushing down on the back, or lifting the belly, trying to elicit a pain response or identify stiffness.
That covers standing still, but horses are obviously athletes, they move, so what about checking them in motion?
Exactly. The dynamic exam is crucial. The horse will be watched moving in hand at the walk and trot, usually on a straight line and then on circles. Lunging is really important too, in both directions, and ideally on both hard and soft surfaces to help show up subtle issues. Lunging can reveal stiffness, reluctance to bend correctly, or maybe asymmetry in how they move. And then, if it's considered safe, watching the horse under saddle, ridden by you or a familiar, skilled rider, is often vital. This lets the vet see those performance problems firsthand and observe how the horse carries itself with a rider, because sometimes the pain really only manifests or gets significantly worse under saddle.
This brings up that really critical question again. If back pain and hind limb lameness can mimic each other so closely, how do vets definitively tell them apart? How do they isolate the primary problem?
That's where a thorough lameness examination of all four limbs comes in. It's absolutely critical. This includes things like flexion tests where joints are held flexed for a period and then the horse is trotted off. And importantly, local anesthesia. Using nerve blocks or joint blocks to temporarily numb specific areas of a limb is key. If blocking pain in, say, a hock joint makes the back pain disappear or significantly improve, it's a strong indicator that the back pain was secondary to the hock issue. This process of elimination is essential to differentiate primary back pain from pain that's just being referred from somewhere else.
Okay, that makes sense. It's like detective work. So once they've done the physical exam, the dynamic checks, the blocking, how do they actually see inside to confirm what's going on structurally?
Right, that's when we move to diagnostic imaging. Radiography, or X-rays, are the go-to for looking at bony structures. They're especially useful for identifying those overriding dorsal spinous processes, the kissing spines. But, and this is a really, really important insight from the sources, finding kissing spines on an X-ray doesn't automatically mean that's the cause of the pain. Radiographic changes don't always correlate perfectly with clinical signs. Plenty of horses have some degree of kissing spines on X-ray, but show no pain at all, and vice versa. So you absolutely have to interpret the X-rays in the context of the horse's symptoms. X-rays are also good for spotting osteoarthritis in the facet joints where signs of spondylosis.
That's fascinating. So x-rays for bone, what about the muscles, ligaments, all the soft tissues?
For soft tissues, ultrasonography, or ultrasound, is excellent. It allows us to visualize muscles looking for inflammation, tears, or atrophy, and ligaments, like checking for that supraspinous ligament desmitis. It's also very useful for evaluating the sacroiliac, or SI region, which can be a common source of pain. Then there's scintigraphy, which most people call a bone scan. This is a functional imaging technique. It's highly sensitive at detecting areas of active inflammation or bone turnover because these areas take up more of the radioactive tracers showing up as hotspots. So it's great for showing where there's increased metabolic activity or inflammation, but it's not specific. It tells you that something is going on, but not necessarily why.
Interesting. And what about the really high-tech imaging, CT or MRI?
Yeah, computed tomography, CT, and magnetic resonance imaging, MRI, are definitely considered the gold standards for getting incredibly detailed images. CT is fantastic for bone detail, while MRI excels at soft tissues. The main limitation, though, is usually the horse's size and the availability and cost of scanners large enough to accommodate them, especially for imaging the back. Thermography, which maps heat patterns on the skin surface, is sometimes used, but it's generally considered non-specific and more of a supportive tool rather than a primary diagnostic one.
That's quite an arsenal of imaging tools. Are there any other diagnostic steps vets might take, maybe even after imaging, to really pinpoint the pain source?
Yes, definitely. Diagnostic analgesia, or blocking, can be used not just on limbs, but directly on suspected spinal structures. This involves carefully injecting local anesthetic right into or around the area they suspect is painful, like between specific spinous processes into facet joints or around the sacroiliac joints. This is often done using ultrasound guidance to make sure the needle placement is precise. If the horse's signs dramatically improve after that specific block, it strongly confirms that structure as a source, or at least a major contributor to the pain. Other things that might be considered in some cases include a full neurologic exam, maybe CSF analysis if nerve issues are suspected, occasionally a muscle biopsy, or even DNA testing for specific genetic conditions like HYPP.
Okay, phew. So once that diagnostic puzzle is hopefully solved and there's a diagnosis, what's the next step? How do we actually go about treating equine back pain effectively?
Well, the treatment plan is always highly tailored to the specific diagnosis, and it's almost always what we call multimodal, meaning it combines several different approaches. It's very rarely just one single fix.
Right. Let's break that down. Starting with medications, what's typically used to manage the pain and inflammation?
Often the first line involves nonsteroidal anti-inflammatory drugs, or NSAIDs, things like phenylbutazone bute or flunixin maglumin, or maybe newer ones like firocoxib. These are really important for reducing pain and inflammation. Of course, vets are always mindful of potential side effects, like gastrointestinal issues, especially with bute, so the dosage and duration are carefully managed. If muscle spasms are a significant part of the picture, muscle relaxants like methocarbamol might also be prescribed.
And what about injections? We hear a lot about injections for joint issues. Are they used for backs too?
Oh, absolutely. Localized injections can be incredibly effective for back pain. Corticosteroids are frequently used, injecting medication like methylprednisolone acetate, often using ultrasound guidance for accuracy, directly into or around the painful structures like between kissing spines, into arthritic facet joints, or around the SI joints can provide powerful, targeted anti-inflammatory relief. Mesotherapy is another technique sometimes used involving multiple tiny injections of medication just under the skin over the painful areas. And then there are other types of injections too. Bisphosphonates, like Osphos or Tildren, might be used if there's evidence of active, problematic bone remodeling. For specific joint, ligament, or even muscle issues, regenerative therapies like hyaluronic acid, HA, IROP, or PRP, platelet-rich plasma, might be considered to help promote healing.
Okay, so medications and targeted injections are key tools. What about physical therapies and rehabilitation? How do we help the horse rebuild strength and flexibility?
Rehab is a huge component. Initially, some period of rest might be needed to let the acute inflammation settle down, but then it's followed by a very carefully controlled progressive exercise program. The goal is to strengthen the core muscles that support the spine and improve flexibility without re-aggravating the injury. This often involves things like controlled long and low work, incorporating hill work to build hindquarter strength, using cavaletti poles or ground poles to improve proprioception and encourage lifting the back, and sometimes water treadmill work, which provides resistance in a low-impact way.
That makes sense. Building that core strength seems crucial. What about hands-on therapies, things like chiro, acupuncture, massage?
Yes, those manual therapies are very frequently incorporated. Chiropractic adjustments can help restore normal joint motion. Acupuncture can modulate pain signals and muscle spasms, and massage therapy can relieve muscle tension and improve circulation. There are also therapeutic modalities that can be very helpful. Extracorporeal shockwave therapy is commonly used, often in a series of treatments, perhaps 3 sessions spaced about 3 weeks apart. Therapeutic laser, magnetic field therapy, and even simple heat or cold applications can all play a role in managing pain and promoting tissue healing.
Is surgery ever considered for back problems, or is it mainly managed through these other means?
Surgery is definitely an option for certain conditions, most notably for significant kissing spines. There are a couple of common procedures. One is a minimally invasive desmotomy of the interspinous ligament, basically cutting the ligament between the affected bony processes to relieve tension and pain. In more severe cases, actual resection or removal of parts of the overlapping spinous processes might be performed. For severe facet joint arthritis, joint fusion is a possibility, but it's quite a specialized and less common procedure. And for something like a vertebral body fracture, surgery isn't usually the route. Treatment typically involves strict, prolonged stall rest, maybe 2 months, followed by a couple of months of careful turnout in a small paddock to allow the bone to heal.
Okay. So beyond the direct veterinary treatments, what does this mean for day-to-day management? What can owners do to support recovery and, maybe more importantly, prevent recurrence?
This is where you, as the owner, play such a critical role. And number one on the list, almost always, is saddle fit. It is absolutely crucial. A poorly fitting saddle is a major cause, or at least exacerbator, of back pain. Getting your saddle fit checked regularly by a qualified professional, maybe annually, or even more often if your horse's shape changes, is non-negotiable. Also, consider the rider. The rider's balance, symmetry, and overall skill level have a significant impact on the horse's back. Sometimes rider lessons focused on position and balance can make a huge difference for the horse. And don't forget the fundamentals. Regular dental care is important because how a horse chews affects its posture. And proper hoof care, balance, trimming, and shoeing by a good farrier is essential for correct biomechanics all the way up the chain.
We've covered a tremendous amount, from spotting those first subtle signs to the complexities of diagnosis and all the treatment options. Looking ahead now, what about proactive prevention? And what's the realistic outlook, the prognosis for horses with back pain?
Yeah, thinking about prevention really brings us back to many of the key points we've discussed. First and foremost, again, proper saddle fit. It's just foundational for preventing back issues. Then, appropriate training and conditioning are vital. That means building fitness gradually, incorporating exercises specifically designed to strengthen the core muscles, ensuring variety in the work so you're not constantly stressing the same structures, and always including proper warm-ups and cool-downs.
Right, so it's not just about fixing problems, but actively building a horse that's resilient to them. What else falls under that prevention umbrella?
Well, consistent, regular veterinary and farrier care is key. Catching small issues early through routine checkups, keeping up with dental care, ensuring hooves are balanced. Weight management is also really important. Carrying extra weight puts unnecessary strain on the spine. Providing adequate turnout allows horses to move naturally, which is good for their backs. Ensuring appropriate footing in arenas is also relevant. And as we mentioned, having a balanced, competent rider minimizes jarring or uneven forces on the horse's back. And finally, just being vigilant. Early recognition and intervention when you notice even subtle changes in performance or behavior can stop minor soreness from developing into a chronic, debilitating problem.
That makes perfect sense. So what is the typical expected course of recovery, and what's the general prognosis like for horses dealing with these issues?
The prognosis is pretty variable. It really depends heavily on what the specific diagnosis is and how well the individual horse responds to the chosen therapies. For something like an acute muscle strain in the back, an epaxial muscle injury, if it's caught and treated early, the outcome is often quite successful. However, for many other types of back pain, getting that accurate diagnosis can remain challenging, and figuring out the best combination of treatments often takes time, patience, and good collaboration between the owner, vet, and potentially other therapists. But even serious issues, like certain vertebral body fractures, can often be managed successfully with the right approach, particularly early diagnosis and diligent rest.
That's hopeful. Are there any potential complications owners should just be aware of during this whole process?
The main complications usually revolve around the difficulty in diagnosis. If you don't get an accurate diagnosis, the treatment might not be appropriate, leading to ongoing discomfort or lack of improvement. Very rarely, there could be complications like infection following injections, but with good sterile technique, that's quite uncommon these days.
Wow, okay. We have certainly taken a deep dive into equine back pain today. We've gone all the way from those, subtle, sometimes confusing signs through these sophisticated diagnostics and into this really multimodal approach to treatment and, importantly, prevention. It's definitely clear that while it's a complex area, taking a systematic, really comprehensive approach gives our horses the absolute best chance for recovery and hopefully long-term soundness and comfort.
Yeah, what's really striking, I think, is just how interconnected everything is. The horse's conformation, its training level, the saddle fit, even the rider's position and skill, it all feeds into the health of the back. It really emphasizes that dealing with back pain isn't just about treating one symptom. It's about looking at the whole horse, the whole picture, the whole athlete, and understanding how all these different pieces fit together and influence each other.
Absolutely. And maybe thinking bigger picture for a moment, given that intricate connection between a horse's physical state, its training, the equipment, the rider, how might really understanding conditions like back pain change how we approach our partnership with horses altogether? Could it encourage us to move beyond just treating problems towards a more holistic vigilance, a kind of proactive care that tries to anticipate needs before they become painful issues? Perhaps thinking about it that way, what's one small change you might make today based on what we've discussed that could potentially make a big difference for your horse down the road?